Welcome to Villa of Hope Radio. Brought to you by Villa of Hope, partnering with individuals, families, and communities to rebuild relationships, recover potential, renew hope for the future. Villa of Hope is all about your personal journey because you matter. Now, with caring hope and respect, we're proud to bring you Villa of Hope Radio.
Hello again, everybody, and welcome to the Villa of Hope radio show. Villa of Hope, rebuild, recover, and renew. This is J.C. DeLass. We're going to be talking about the opioid epidemic in our area and how that's related to COVID as well. I've got some very interesting guests coming up. But first, we're going to start with the Chief Advancement Officer at Villa of Hope, Gerianne Puskas, to give us an update on some of the other things that have been happening with Villa of Hope. And Gerianne, I want to start right off with the golf tournament you had recently, a big success, I understand.
It was a fantastic day. What a terrific opportunity for people to get out and see other humans in a social way, in a socially distant way as well. But it turned out to be just one of those absolutely perfect days. Everybody had a terrific time. And they really pulled through. We raised what we needed to raise, and a lot of people got to hear about Villa of Hope and some of the programs and what's new and what's happening at Villa of Hope is, as you know, every month we've got some new things going on, and it was a great opportunity to share that with people in our community. Well,
and that's the thing too. The golf is a great part of it, and my understanding you were out on the west side, right? Was it Deerfield?
Yeah, out at Deerfield Country Club, which is just stunning this time of year.
Yeah, that is a beauty in our area, and I know they treat you right, so that right off the bat is a great thing. You get a chance to play a wonderful golf course, but maybe even more importantly, as you said, this is a great opportunity to have some of that community outreach and show people what Villa of Hope's all about.
Exactly, to hear what we're doing in the community, to see some of our workforce development folks actually working at the golf tournament, helping out and volunteering, and just to talk to staff, as people are waiting to golf, they have the opportunity to ask the staff what's new, what's happening, how do you like working there, and it's just that rare opportunity that you don't get in other ways,
And you said you hit your number, too, and that's important because the money that you raise from that tournament really does go to help the services that we always talk about with Villa of Hope.
Yes, and with COVID, it's been a challenge, but I must say our community has risen to the challenge and supported the Villa, knowing that a lot of our services right now are in high demand, and we're finding every way, that we can to meet that need and to have the community come out and support us. When it's very easy to say, no, I'd rather be home, I'm going to be home, be safe. We really appreciate that folks came out, had a good time, but really supporting the agency and everything that we're doing, and then going home knowing what we do and able to help their friends and family as well.
We're with Gerianne Puskas, Chief Advancement Officer at Villa of Hope, and switch gears just ever so slightly with school now well underway. You're a good month, almost 2 months into it now. How's that all working out, especially with COVID and some of those restrictions in place? How's school kind of holding up with all that?
Oh, every day's an adventure.
Yes, it is.
It's, actually it's going very well. The school administrators and teachers and the staff are so organized, and they are really, really into what they're doing. We see the kids in the morning lining up on the sidewalk on their little markers so that everybody's got their masks on. The nurse and the support teams are taking temperatures, escorting kids to class 2 at a time. And it's just, it's really great to see how these structures and these new processes were put into place, and everybody is on board with it. It's not a reason for a rebellion; it's a reason to come together. And I think that's kind of one of the things that we're seeing as we go through this COVID is that for all the opportunities that we could drive each other apart, our community is finding ways to come together. So it's going very well.
In terms of successes, probably just the number one success is the fact that you've been able to do this, right? Because it is very tricky stuff.
It is, and it's, there are some times where it can be tricky and, someone may not know where to go or how to go somewhere next. And honestly, for a few months, a lot of our students were at home and they didn't get out, and so now they're adjusting to being around people again. If you can imagine teenagers who were stuck at home for 3 months and not going anywhere, and now they're back around people, it can be a shift. It can be a change. So, that's one of the things that we're looking at, how can we do things better? Providing a brand new comfort room so that, if you need some place to just go for 5 minutes and to be alone and to kind of pull yourself back together, we have a safe place for the kids to do that. We've seen some referrals coming in from districts, but we anticipate that as school kind of gets further along, we're going to see some more referrals coming in from the different school districts for kids to come check out the Villa of Hope School. But overall, very positive feedback. We're doing our curriculum nights on Zoom, like everybody's doing everything on Zoom and whatever platform they're using. But we're finding that some parents are actually able to do that as opposed to having to come out to an evening as well. So there are pluses that we're finding in all corners of this.
Gerianne, what are you seeing in terms of the mental health of students and again, how they're holding up with all of these different challenges that seem to get thrown at them constantly now?
Yeah, I think what we're seeing, as I mentioned, I think it's that trying to adjust between you can be around people, you can't be around people. And I think when we look at a lot of students at high school age, they need to have kind of a plan. They need to know what's going to happen next. And when things change quickly, it can be very stressful. And that's when grades start suffering and other things start happening. So one of the nice things, I think, is that at Villa of Hope, we have a very low ratio, student-to-teacher ratio. So our teachers have the opportunity to talk about those feelings and to help walk through that, and for smaller groups to really kind of process that together. Because that is something that, when you feel like you're the only person in a room of 40 or 50, it can be very, very depressing and isolating. So we're trying to break that down before it even gets to that point. But that really is, we see that with adults too, adults who have been isolated who normally aren't. Adults who are stressed out because they don't have jobs. Some of the kids are expressing stress because their parents have lost their jobs. So there are some external stressors that are coming into school and affecting kids in the school, but that's what we're experts at, is helping them deal with that.
Gerianne Puskas, Chief Advancement Officer of Villa of Hope, with us, and a lot of different things happening at the Villa overall. I know you've recently added some new leadership members of the team.
Yes, in the past few months we've had a couple of new positions open up, and positions that we had that opened up as well. But we've added Wendy Turner as our Chief Human Resources and Diversity Officer. We added Chetna Chandrakala as our Chief Financial Officer, and Lindsay Gozi-Theobald as our Chief Program Officer. So, we had a couple of those positions have always been a part of what we do. Wendy's position as HR and Diversity Officer is, we've talked in the past about our efforts in wanting to understand structural racism and to find out how we can help our community learn and grow. Bringing Wendy on to help drive that in our agency so that all staff and we're all marching in the same direction, I think she's just an amazing add. All of the new chiefs are, and what's nice is that they're bringing experience and they're bringing knowledge as we're looking forward to our Vision 2030 and working in that direction. I really feel fantastic about the strength of this team. It's just amazing. Chris has really done an amazing job putting a team together.
Well, I know you're also expanding, too. Villa of Hope always growing and finding different ways to help the community, and you've got an expansion project that's ongoing right now.
We do, and this is one of those reasons why we need to have strong leadership. We've got some capital projects that are going. We are getting ready. We actually have a piece of equipment on our property, so I could tell you it's going to happen soon. It really is. But we're getting ready to break ground to start our Miller Building outpatient mental health clinic on Dewey Avenue on the property there. And so that'll be phase one of our two-phase project. Phase two will be breaking ground on our new detox facility, Living Hope. And we're hoping that next year at this time, we're going to be having the kind of conversation where we're talking about how we've already started saving lives there. So, we're really, really looking forward to that and being the only detox in Monroe County that also serves youth ages 16 to 18 in addition to adults. So we're going to use some of our expertise to help out in ways that others haven't been able to. And unfortunately, there is a need for that. I hate that there is, but we can meet that need, and we want to do that.
That Living Hope detox home, the location of that's going to be perfect too, right?
The nice thing, one of the things that happens is people either they go to the hospital and they're discharged and they're not put into a proper detox facility or other program. When they get into a detox program, they get out, they may not be connected to another program properly. So it's those breaks in the continuum of care. That's where you have some of those really big problems, and some of the, as I'm sure Sheriff Baxter and Dr. Mendoza are going to talk about, overdose and overdose deaths when somebody comes out of those situations and goes and does drugs because they're not into another treatment program. Our program, our detox center, is going to be located on the Dewey Avenue campus. And so on one side, if we have a young man under the age of 21 and they get out of detox, they can literally go right next door to our residential rehab for young men. Or we can literally walk to the other side to the new Miller Building Clinic that is also going to have substance use treatment as well. So there's going to be a continuum of care where, patients and guests who are in Living Hope are going to be able to see where they want to go and have an opportunity to walk there, see it, meet the people, meet the therapist, and really make the choice to commit to do this and have that kind of, it's not a handoff, it's literally let's go take a walk together. But that's where we're trying to close those gaps in that continuum so that there just is no way for some of the slippage that may happen if there isn't that guidance.
Well, Gerianne, the last couple of shows, we've talked a lot about structural racism in our community and also the Villas initiative involved with that. What's the latest with that? What are some of the things you're doing now involved with that initiative?
Yeah, we're really keeping up with what's going on in our community. First off, like I said, we brought Wendy on board, and she's really moving internally with a diversity, equity, inclusion, and belonging mission and vision, and we're getting into a lot of affinity groups, as well as some other group facilitation for really having some conversations and really honest conversations with each other. Externally, Villa of Hope, really, we want to be at the table. It's one thing to say that as an agency, Black Lives Matter, but what we need to do is we need to show that, and we need to be present in our community, and we need to be at the table, to make sure that we're supporting the right initiatives. So we have signed on with the 21-day challenge. We've signed on with the our MAPI Workforce Development Pledge, which is an opportunity for employers in Rochester and Monroe County to commit to some best practices in employing individuals in poverty and, taking a look at our hiring, retention, and promotion policies, and it really is towards it's a commitment towards implementing those best practices. So, making the commitment publicly and with others at the table that we are going to do these things with our agency, but then also working on some of the work groups. We've got a couple of staff on the race work groups in Monroe County. It really is that we don't want to say it, we want to be it. And so we're trying to find ways that we can absolutely be at the table, and some of our fantastic staff who are so passionate can really make a difference.
We have just a couple of minutes left, and Gerianne, I always ask you that priority list. It gets longer and longer every time we talk, right? That yellow legal pad's got a lot of stuff on it right now. What's up near the top for you and for Villa of Hope right now in terms of those priorities?
I think it's making sure that we can two things. It's making sure that we can get these programs up and running with the clinic and with our detox center. We are very focused on making that happen because our community needs it yesterday. There is a strong need for that, and even some of the conversations that we've had with Dr. Mendoza in the past, it is so how are we going to make sure that people know how to access this and that they know it's here, and how can we work smartly to make sure that our community makes the best use of these services? So that is a big focus of ours. How are we going to be, I hate to say marketing, but how are we informing our community of what is available and how to access this? And then, of course, it's being at the table to really help our community at large. We are always trying to interrupt the cycle of poverty, and we are now connecting so many other things with poverty. We need to be at the table to solve these problems in a big way. And I think so many staff at Villa of Hope are so uniquely qualified because where they work and their trauma-informed care background and just the ability to really bring the heart and head to the table and think through some of these issues. So I would say those are our two biggest priorities at this time. And of course, everything else that we have going on. I say it every time, right? We just have an amazing staff that does things every single day that you just wouldn't expect folks to do for others in our community, and I give them all the credit in the world.
Yeah, everybody's going above and beyond the call these days, aren't they?
Yeah, they sure are.
No doubt about it. Gerianne Puskas, Chief Advancement Officer for Villa of Hope. Thanks so much for joining us. Continued success. We'll talk to you again next month, all right?
Thank you so much.
We're going to take a break. When we come back, we'll talk with Monroe County Sheriff Todd Baxter about the opioid epidemic right here in Monroe County, and also learn about some of the changes during COVID as well. You're listening to the Villa of Hope radio show right here on the WYSL stations. Welcome back to the Villa of Hope radio show. Villa of Hope, rebuild, recover, and renew. This is J.C. DeLassett. We are so happy to have our guest coming up for this segment, Monroe County Sheriff Todd Baxter, joining us. And I'll tell you what, there aren't too many busier people right now, certainly in our area, than Sheriff Baxter. Thanks so much for joining us. And first thing, I want to just check in. How are you doing? How are your guys and gals doing, the members of the Monroe County Sheriff's Department? A lot of challenges these days. How's everybody holding up?
JC, thanks for asking about them. It's a very difficult time to be a law enforcement officer right now. We all know many reasons why, but we go back to late March with the onset of COVID. These guys and gals have been nonstop work since COVID started spreading to our environment. Whether they're inside the jail trying to keep that place safe and secure and sanitized, to the road patrol that we're helping Dr. Mendoza out with so many tasks initially in March and April. Then, of course, with the tragic event in Minneapolis and the civil disorder that's occurred and the Prude case here in Rochester, it's just been an incredible pace. But the deputies are responding every time I ask them. They jump, and I can't appreciate them enough.
I'll tell you, the stress that they must be going through, and again, you throw in social media and all the other pressures that come with that. I just don't know how they're able to handle that. I mean, really, it is a special group you have with you right now.
Yeah, you just take a simple protest that may occur, and they've been occurring since late May, right, on a continuous basis, almost 4 months. Every one of those protests, we are critiqued, it seems like, by everybody. We're critiqued that we went too hard, we're doing too much, and we're critiqued on the other side, we're too soft, and we're not doing enough. And that's the dilemma they're staying in. But, we've done protests for years. We had war protests years ago. We've had abortion protests, abortion-related protests. So, our job is a total line, keep everybody safe, and also provide the opportunity for people to express their opinions underneath the First Amendment, which we all love and believe in. But, it's a little more difficult when you're protecting the First Amendment and they're screaming at you about you. But these are professionals. They stand that line and they do their job. And there's enforcement that needs to be done. They do the enforcement, but they're really there and designed to keep people with their First Amendment rights to even yell at ourselves, yell at police officers. It's a unique environment. But again, these guys are professionals, so I'll give it to them.
Well, and it's frustrating, again, when I see people, taking shots, like you said, the Monday morning quarterbacking that goes on with certain members of political organizations there. I'll be as vague as I can possibly be with that, but you know what I'm talking about. It's frustrating, I think, for regular, everyday citizens like me to see that when I think, boy, you don't know what it's like to walk in their shoes right now. It just to me, it's just mind-boggling. And I know, again, you've talked about it. Your officers are handling a lot right now, more than anybody ever thought that they'd be able to handle.
Yeah, they are. I mean, the amount of overtime they've had at work, and people look at that as, again, a negative or a positive. You know, it's funny how people say, well, they're making a lot of money. You know, they'd much rather have spent the summer home with their kids in the pool, or walking with their wives or their husbands on a nature walk, or 1,000 other things we could have been doing this summer. But those guys and gals that work 12-hour shifts multiple times for us, and did it every time, like I said, we've asked. And let alone the pressure that comes with that. You know, they make a single mistake right now, they feel the scrutiny of the world coming down upon them. And that's a tough way to do any job. You know, one pastor put it to me not too long ago, we're expecting perfection. We're expecting perfection like we expect an airplane pilot to be perfect. You know, those expectations are kind of high. Yeah. You know, I'm expecting professionalism every day, and I anticipate perfection, but we're humans inside a blue uniform. And even if we do make a mistake, let's stand up and own it. But, you know, to hold everybody to a perfection level, I don't know any industry that does that. And last time I checked, God forbid, I'm getting ready to take a flight myself, you know, airplanes crash too, and there's mistakes made, mechanical mistakes or people mistakes, and so let's not be overburdensome on our people too at the same time and expect perfection. How about professionalism?
Yeah, I 100% agree. Monroe County Sheriff Todd Baxter joining us. Well, let's shift gears ever so slightly. I mean, with COVID involved here, we've really focusing here on the opioid epidemic, and we're going to talk to Dr. Mendoza, the Monroe County Public Health Director, coming up in the next segment. But I'm curious from your perspective how you feel like COVID has affected the epidemic and what you're seeing firsthand with the opioid epidemic.
Yeah, so we had, I came on board January of 18, and we put together a Monroe County Heroin Task Force, spent a lot of time and resources on the enforcement end of it. We spent a lot of time on the recovery end. We dedicated one deputy. His full-time job is to save lives, I tell him. I didn't know what that meant when I gave him the job, but I said, go out there and get with these families, get with these folks that are surviving an OD, and let's see if we can get them out of that cycle, the cycle that's leading to death at an extreme rate. You know, 220 deaths years ago in our community is an extreme number if we think about that. So we've been pushing very, very hard on that. But what we saw is the COVID experience. We've seen our numbers spike back up in March and April. You know, we've seen the number of fatals go up. We've seen the number of overdoses in general go up. Even the experience with Narcan, the number of Narcans that were administered went up. So COVID definitely had a negative effect on our driving the trend line down. We are starting to recover from that now. We've seen the last couple of months the trend lines continue down and even go lower than what it was in certain portions of 2018 and 2019. So I think we're back on track to drive those numbers down, but we did take a hit with COVID, that's for sure.
Well, in speaking of the hit with COVID, I know the Monroe County Jail was doing a program, a STAR program. Tell me a little bit about that and where that sits now.
JC, I could not be more excited about that one. You know, people ask me why I ran for sheriff, and one of the reasons was the jail. You know, it's exciting to be in charge of corrections, and you have people that are in custody, and what do we do with these folks that when they're going to leave custody sooner or later? What have we done with these folks to get them on a path of success? Of course, there's out of 700 inmates I have today, there's probably 100, 150 that deserve never to get out of jail. They're murderers, or they're rape suspects, they're domestic abusers. But the rest of those, 500 and some, are people that made bad mistakes, grew up in poverty, had no job, had no job skills, society, and we, and they're all a microcosm of our society as a whole. So my desire, my passion is, what do I do with the people that really want to change their life while I have them in custody? And that Star Academy is something that we built together. We take a cohort of inmates, put them through an academy-style process of the jail, so they live together, they get up together, they eat together. The deputies that work with them are volunteer deputies. They want to work in this environment. And they push these guys to work on their social, emotional, addictions, financial skills for the first 3 months of this academy. In the second 3 months, they work on their job training and job placement to the point that we're going to place them in employment while they're still in custody. Let them go out and earn a paycheck. We've started M&T bank accounts with them and have them pay off some of their bills and some of their burdens before they leave jail, and create relationships that they're going to need when they leave jail. Create them while they're in jail, so they're not some ex-con showing up to a job. They've been working there for the last month and a half anyways. They just changed the place where they lay their head. So very comprehensive program that we put together called the Star Academy. So thanks for sharing that, JC.
Well, and I'm curious, too, because, I mean, it sounds like a really intense, rehabilitation program. And really, I know from previous conversations with you before, I know that's something that's so important and unfortunately seems to be lacking because you're trying to prevent repeat offenders and people constantly going through the system. And here's a program now that maybe can break that trend.
Yeah, I challenge my staff to start out slow, start out with a small cohort. We'll learn some things we did really well. We'll learn a couple things that didn't work so well. They were good on paper. And then we'll build upon that with the next cohort. And then we'll start a female cohort. And we'll continue to build and build. The idea is, if these folks want to change their life, first of all, we as taxpayers should give them that opportunity because if they come out and haven't changed their life, they're going to re-victimize people. They're going to commit crimes. Their families are still going to be torn apart. The victims' families are going to be torn apart. We as taxpayers got to pay $130 at a minimum to incarcerate them next time they get, put back in the Monroe County Jail. It's a lose-lose proposition not to work with them. Where we found a win-win-win, where these people are paying off their child support, they're paying off their fines in New York State for their driver's license, they're leaving with good jobs and good job placement with support mechanisms to keep them on the true north when they leave, and their families. We're working intensely with their families to get their families reintegrated with them so they can be parents, and so they can show some pride when they're spending time with their kids and learning some parenting skills. So the families win, the future victims that aren't victims of crime win, the taxpayers win. It only makes sense, and it's not soft on crime. Trust me, these guys are up at 5:30 every morning. They're working 10 times harder at the Star Academy than we work downtown, just laying in a bunk all day and doing the minimum stuff we make them do. So they're putting a lot of sweat and equity into this program too. The inmates are.
How can we keep that program going, Sheriff Baxter? Because, I just love what I'm hearing. I don't know if there's anything people can do to help, but that sounds like a real winner to me.
Yeah, we talk politics, believe it or not, and even from the left side of the house, I was getting a lot of kickback when we started this because, this ain't the job of law enforcement. And my response is always, if we're not doing it, then who's going to do it? Because no one else apparently is,
Right.
We talk about the mental health inside the Monroe County Jail as an example. We had the largest number of mental health patients inside the Monroe County Jail than anywhere else in Monroe County. We talk about poverty. We got the most centralized poverty inside the Monroe County Jail than anywhere else, any other community. Everybody in the jail is just about in poverty. So we got to create programs. So what I need support from the community to support, these programs at the jail because believe it or not, we get kickback from both sides of the aisle when we try and do innovative things. Some people think we're doing our job that it's not our job. Other people should be doing it. And other people are like, why are you wasting taxpayers' money taking care of people that committed crimes? And my goal is to make sure they don't commit another crime because they're going to get out someday. And let's not be foolish about this.
Well, and you know what? I made mention to those Monday morning quarterbacks in the various political organizations. Now's the time to reach out to those people, and everybody knows who I'm talking about. Let's reach out to those people. Let them know, hey, you all want to talk about the bad things happening because that's that's hot stuff on social media. Here's a good thing that's happening. Let's talk about that. Let's support that, and see if you can get some of those people behind it too.
We had to slow down the Star Academy because of COVID, right? It changed our whole world, including how we incarcerate people in the Monroe County Jail. But even during that process, I had one of the Star inmates, walk up to me the other day and was proud as a peacock because he just paid off his New York State driver's license fines, and he was walking around in jail with a New York State driver's license. First time I think he's ever had a valid driver's license. Think of that burden we took off his back when he leaves jail, that he can actually drive a car and not look over his shoulder every time he goes to signal a turn or drives to work.
WYSL Avon Rochester.
Yeah, I love it. We're with Sheriff Baxter here, Monroe County Sheriff, and you mentioned the intersection of mental health and you put that together with addiction response. I'm curious, what other programs do you have in place right now, specifically in that mental health and addiction realm? Because as you know firsthand, that really is the biggest, maybe the biggest problem we have in our community, and we need programs to help respond to that.
Yeah, absolutely. We did a point-in-time survey probably about 2 years ago now of the population of the jail in one day, and 66% of the people in the Monroe County Jail had a mental health transport or mental health diagnosis sometime in their life. Wow. And then we all know the state of addiction. We talked about the opioid state that we're in, and the number of deaths and the carnage across our whole community with this epidemic. And those all end up, our jail is, again, a microcosm of society, and they end up inside the jail. So we created in the jail a MAT unit, a medical assisted therapy unit that actually brings drugs, if you will, Suboxone and other drugs, into the jail to stabilize people that are going through their addictive state while they're incarcerated. But with that, we also brought in a full-time staff that works on the addiction process, works on the 12-step programs, if that's what's appropriate for that particular inmate, works on continuous training and all the things that you need to do to get your addiction under control besides just, not repeating the use of the drug, because they hopefully they won't while they're inside my jail. But the fact is they're going to be leaving sooner or later. And so that MAT unit is something that we started brand new, fought my staff to bring drugs into the jail. That was actually against their norms. But, we with medical prescriptions, let's get the drugs in these jails that are helping them bridge the addictive state, and then we can work on them more intensely while they're in jail. It's been a great learning tool for us. We started a whole wing. We made it a nice-looking part of the jail, and we got inmates that are, encouraging themselves, each other, living again in that cohort model with other people going through the same struggles so they can support each other. It's been pretty fun to watch us grow that out.
We have just a little bit of time left here with Monroe County Sheriff Todd Baxter, and you made mention, and it was a few weeks back, talking about the eyes of the world are watching Rochester. How do you think we're doing?
Well, I think we have a great opportunity in front of us. So, the eyes of the world were watching us. They are watching us. We did not turn into a Portland. We did not turn into a Seattle. We had one hell of a kick in the groin. We went through the experience of Mr. Floyd's passing, and people were angry, law enforcement, and the protest, although May 30th got out of control here in Rochester, New York, with the looting of 70 stores and the burning of police cars. But the anger was understandable, right? We understand the distrust of law enforcement. You can't deny that, right? We got to acknowledge it and then see how we can build from it. Some is just, some is not. But if we don't have conversations, fast forward to the death of Mr. Prude and the revelation of that and how that came out. That was a powder keg waiting to explode with all the other experience we had through the summer, and the fact that we did not explode. We got to give credit to law enforcement. We also got to give credit to the community that helped control that. We got to give credit to people that are willing to have these difficult conversations. We had every potential of turning into the next 3, 4, 5, 6 nights of straight rioting and burning and looting, and we did. And I think that's a testimony in some of the most dire straits we were in of response by everybody. Some people again say we're too hard, we're too soft in law enforcement. Some people, people always critique that, but I think if you look back, a year or 2 years from now, and you look at the recipe for disaster, we had it here in Rochester. Though it could have been easier and better, I think we didn't blow up, and I think that's a testimony to our community that. That did not occur for many, many reasons.
Yeah, no doubt about that. Well, for folks that are listening now, they're driving in their cars and they've heard what you had to say, and maybe they're thinking, well, what can I do? What can I do to help? And I know that you need that support, and whether it's calling a Monroe County legislator, calling a city council member, or whatever it may be, there's things that people can do to help, aren't there?
Yeah, JC, absolutely. The rhetoric does not help, and the political rhetoric actually hurts, and it's dangerous. If people want to talk about defunding, that's a negative connotation right off the bat. If people want to say, how can we better serve the community with tax dollars, whether it's mental health responses, whether it's opioid responses, whether it's domestic violence responses, and there's better ways to do business, we should always be evaluating and willing to critique ourselves and adjust fire. At the end of the day, these are tax dollars that we're spending. They're not my money. They're no one else's money. It's taxpayer dollars. So having those conversations, but politicians need to be held. Their feet need to be held to the fire too. Where they sit out here and they spew rhetoric, hatred, rhetoric, whatever term you want to put on it, is no good to anybody. But if they want to sit down and say, let's have logical conversations about better ways to do things in our society, then be a leader and have those conversations. Force people to the table if you're a political leader, and let's have those conversations. But we really got to be careful, and the only way we can be careful enough is if the constituents are in charge. Right. And we got to realize that, the constituents are in charge, and they need to use their power and their voice to make positive phone calls, positive adjustments in our society if they see that necessary, but also hold us accountable as elected officials by making, if someone's using rhetoric and spewing hate, they need to be called on that too. There's plenty of room for opportunity for change. There's plenty of room opportunity for conversations. I'm willing to have a conversation with anybody and even critique and look at ourselves. But we can't do that under this, throwing, burning arrows at each other all day long. It'll never end, and actually it's dangerous.
No doubt about it. Monroe County Sheriff Todd Baxter joining us. Thank you so much, sir. I know you're very busy. A lot happening, of course, in our area right now. Appreciate every time we get a chance to talk to you. I always feel better after I talk to you. I don't know why. I feel like there is a little bit of hope out there, right?
Yeah, you know what? At the end of the day, our society's been through a lot lately, but our country's been through a lot for 200-plus years. And if we take care of each other, take care of your neighbor next door, take care of your family, we'll be okay. And let's work on the rest of the stuff like we should. And that's through processes, not through rhetoric.
Thank you for your time, my friend.
Thank you, JC.
We're going to take a break. We'll come back. We're going to talk to Dr. Michael Mendoza, Monroe County Public Health Department Director, learn more about COVID and also the opioid epidemic and how they're connected as well. You're listening to the Villa of Hope radio show right here on the WYSL stations.
For over 75 years, Villa of Hope has risen to meet the changing needs of our community. Caring staff at the Villa know trauma and how it can change your life. As we face personal challenges, the Villa stands as a place where individuals, youth, and families can rebuild relationships, recover potential, and renew hope for the future. For more information, visit villaofhope.org or call 1-833-993-HOPE.
You're listening to Villa of Hope Radio on the WYSL stations.
Villa of Hope is here to help. Our Monroe County Department of Public Health is working diligently to reduce the chances of spreading the COVID-19 virus, and it's important we all follow those recommendations. That does not mean you cannot reach out for help. The Villa is here. We have people ready to take your call and get you the help you need. Whether you need general counseling, family support, MAT, or a compassionate ear, we are here. Call 1-833-993-HOPE.
And welcome back to the Villa of Hope radio show. J.C. DeLass here. Villa of Hope, rebuild, recover, and renew. And talking about the opioid epidemic that's in the Monroe County area and also in our general area as well. And for that, we're going to bring in a very special guest, Monroe County Public Health Director, Dr. Michael Mendoza, who obviously is a very busy guy these days with everything that's happening with COVID. And Dr. Mendoza, I really want to focus in a little bit more here with the opioid epidemic. I saw something recently where people are saying all the focus right now with COVID, and it almost seems like opioid kind of got put a little bit on the back burner in terms of public perception. But I know that's not the case for you and your department. Opioid misuse really still a serious public health crisis, isn't it?
Absolutely. The challenge, of course, is that people only know what they hear, and for good reason, obviously. The COVID pandemic has grabbed the news attention and the media and so forth, and that makes good sense, but I think it is incorrect to assume that nothing's going on behind the scenes. So, in fact, with all of the response to the COVID crisis, with social distancing and all of the lockdowns and all of we've gone through, our worry is, of course, that the opioid crisis has worsened. And so we absolutely want to pay more attention to it, even though it's not grabbing headlines like it was a year ago.
Well, Dr. Mendoza, the opioid misuse, as we talk about it, is a public health crisis. And I know most recently there's a quote here I have: structural racism puts people of color on the front line disproportionately. Can you tell me what that means?
Well, it means a lot of things depending upon what issue you're talking about. So the context for that quote was that we were talking about the disproportionate impact of COVID on cases, and we saw that particularly earlier in the epidemic, women in their 20s, typically women of color, were being disproportionately impacted by COVID, and that we saw higher case rates in that group. Thankfully, it didn't turn out to be that there were greater hospitalizations or fatalities, thankfully. But if you look at why that was, when we defined essential employees early on, essential employees in that context was typically people from African-American communities who were working on the front lines in nursing homes, in grocery stores, in hospital settings, and not typically nurses, but the nurses' aides and the medical assistants and the LPNs and so forth. And so that is the reason. And so, the structural racism component of that is sort of asking ourselves, how did it get to be that people of color from those communities was being disproportionately exposed to COVID? And it has a lot more to do with the economics and all of the history that led us up to where we are in 2020, and why those individuals were disproportionately represented in those frontline positions.
That connection between COVID rates and the opioid epidemic, was that something that surprised you initially, or when you saw that and how that was developing, that kind of fit with what you were thinking to begin with?
It's not surprising to anybody in healthcare. We've been dealing with health inequities for a long time. It was really just a matter of time before we started to see it in the data. But, those of us in healthcare see this all the time. We see it play out in a different arena all the time. And so it wasn't surprising to us to see that it was coming. It was really just a matter of time when we saw it in the numbers.
When you look at the public health system in our area, and specifically Monroe County, it really looks like the disparity in terms of where you live, for example, one zip code versus the other zip code. How do we fix that? I mean, do we have to really start all over in terms of the healthcare system? Is that really the only way to try and get some level of a level playing field?
Well, it depends on who you ask. And those of us who've been working in disparities for decades know that it's going to take, both a long time and a serious look at how we do things in order to expect something to change. The reality is, as tempting as it might sound, we can't just erase the slate and start all over again. So, and I think that's an opinion that I have based on my years in practice and years working in healthcare systems. You just can't, because to do that would involve undoing, so many systems, involving regulations and payment and reimbursement and scope of practice and all these things that you just can't change on the turn of a dime. So we've got to find a way to adapt new practices to the evolving scopes of practice and reimbursement patterns and regulations and so forth. So, it's a little bit of both. We've got to evolve, and there's a little bit of evolution and a little bit of revolution.
When you look at what's happening right now, not just in our community, but in our world, is it frustrating for you, Dr. Mendoza, to see seemingly how public health issues have become politicized, and it's one side of the aisle or the other side of the political aisle, whereas it would seem to me if everybody worked together, we would be doing much better off, but it just doesn't seem like that's the world we're in anymore.
Well, the world is a complicated place, but I will say that public health did not need to be politicized. My position as the Commissioner of Public Health is to represent the science and the best practice. And, science isn't red or blue. The COVID-19 epidemic doesn't care if you're a Republican or Democrat. It doesn't care if you live on the west side or the east side. This is all about humanity, and we've got to work together. And I do believe that we can. I believe that the vast majority of people live somewhere in the middle, and the vast majority of people are open to hearing information that can change their mind. And our job in public office is to be transparent and to communicate clearly with everybody. I don't pretend to think that I'm going to change everybody's mind just because I say something. We've got to have a conversation. We've got to enter into a respectful dialogue, and that's how we change hearts and minds. And I don't think it has to be from the standpoint of, Republican or Democrat. The reality is I think most people are reasonable and want to do the right thing for themselves and their families and are open to hearing new information. But if we approach a conversation, as though we're in for a fight, well, then that's what you get. But if you approach a conversation with the intention of listening to understand, I think you get a lot farther with a lot of conversations.
We have Dr. Michael Mendoza with us, Monroe County Public Health Director. And Dr. Mendoza, I know recently you brought in a Director of Addiction Services, Dr. Tisha Smith. What will her role be in Monroe County now?
Well, as you probably know, this is a new role that was appointed initially by the county executive, Adam Bello, and his campaign. After a lot of discussion between himself and my office, we decided that this isn't just about opioids. We really need to look at addiction very broadly, because addiction is a chronic illness. People don't choose to have addiction in the same way that they don't choose to have high blood pressure or diabetes. We've got to apply best practice in public health to addressing both the development of this chronic illness and all of the manifestations of this chronic illness on people's lives. We've got an acute opioid crisis right now, which is that people are dying in disproportionate numbers from opioids. But, someday it will not be opioids, but it will be some other drug of abuse, of misuse, that we will have to pay attention to. And if all we do right now is pay attention to opioids and Narcan, we may get through this epidemic better off, but we will not be prepared for the next one. And I think we have to do a little bit of both. We have to pay attention to the opioid crisis because it's the here and now, but we also have to look at what causes addiction. What are those childhood exposures, those experiences that predict whether a person as they grow older is at risk for use disorders, for addiction. And so we've got to pay attention to both. And so my intention with Dr. Smith on board is to pay attention to both, to look at how do we prevent addiction, how do we identify the risk factors for addiction, while at the same time we get people who are struggling with opioid use disorder into care, into long-term primary care, into all the rehabilitation services that they need to get them out of the throes of addiction. The opioid crisis is unique, but it also shares a lot of features with other addictive disorders, and so we've got to pay attention to both.
It sounds like, in particular, addiction and the opioid situation, this is constantly changing, isn't it? I mean, you guys are kind of learning. You have a set of knowledge, but it seems like things constantly change, and it's very tricky to kind of keep up with it, isn't it?
Well, the opioid crisis is not changing nearly as fast as COVID. COVID changes, every week, every day. But the opioid crisis is a chronic illness, and while it might feel like it's changing often, those of us in the field know the basic principles, and that has to do with mental health and the importance of mental health, the importance of longitudinal chemical dependency care, and the context that all of that plays in chronic illness management. And, when you look at chronic illness management, we've been handling chronic illnesses for, the better part of the 20th century. So the question really is, how do we apply what we know about chronic illness management to addiction, which is relatively new? I think it has not been relatively long that people have viewed addiction as a medical disorder, but it is, in fact, a medical disorder of the brain. And so once we in the field make that leap, it doesn't take very much more to say, well, okay, let's apply what we know about heart failure and diabetes care and cancer care. What can we borrow from what we've developed over the last, 70 years in those fields and apply it to people who struggle with addiction? And so, we have a head start, I guess I would say.
As a community as a whole, Dr. Mendoza, what can people do to help? I mean, what can they do to pitch in or help out in this particular situation?
I think it really comes down to how do we treat one another. When you encounter somebody who's struggling with addiction, I would encourage everybody to check themselves and say, what images come to mind? What words come to mind? And what are the biases that we come to the table with when we think of somebody who's struggling with addiction? I think the temptation is that we have this sort of picture in our mind of somebody who might be different from us. But I would challenge everybody to say, well, the person with addiction may look just like you. And, when you look at it in that light, hopefully we'll come to realize that people with addiction are people just like us. And, to recognize the humanity in these people's lives, that these people are loved ones and they have jobs and families and aspirations and dreams, that they may or may not have gone through a history of trauma or some other difficulty that might have made them more likely to be in this place. But at the end of the day, to recognize it's not their fault. That is, I think, where we need to go. And once we get over that stigma, that We always talk about stigma, and where does it come from? It comes from this place where we don't necessarily agree that everybody deserves dignity and respect. And that is where I think we need to start as a community, because those of us in healthcare, and yes, there are people in healthcare who need to have that sort of exercise in their mind as well, but it starts as individuals. All of us need to sort of have that conversation in our head. And then once we can agree on that, then the systems that care for people with addiction, I think, will not be as hard to build or improve upon if we can all agree that these people are as deserving of our care and our compassion and our love as somebody with cancer or heart failure or diabetes.
I think the other part of this equation, too, is, for example, if you have a member of your family who is struggling with addiction, there's help out there, whether it's through Villa of Hope or any number of other services. I think, Dr. Mendoza, sometimes people feel like, just throw their hands up and say, well, what can I do? But there's people out there that can help.
There is absolutely people out there that can help. We've talked a lot about increasing capacity, but the reality is that we have a whole lot of capacity that's not being utilized. We've got services, we've got people, we've got programs. The last thing I want to do is build more programs if we haven't paid enough attention to connecting people with those programs. And part of the goal of having Dr. Smith on board is to do a better job of connecting. I will say that we haven't done a good enough job connecting with people in the city, people representing communities of color, having multilingual services available to people that addresses the broad swath of culture and racial diversity that we have in this community. So that is an area that we want to do a better job with. But I don't think that the answer should be build more. We need to build better. We need to have people connected to the services that we have, and then if there's a gap, then we talk about building. But there's a lot of good people out there who are willing to help, particularly people with lived experience. We talk about the impact of peers. That's not a new concept. We've been working with peers, across a lot of different aspects of healthcare. That we've only relatively recently come to recognize the role of peers in opioid use disorder is really a problem with us. We should have figured that out sooner. But now that I think we figured that out, part of the team that Dr. Smith is building right now is a team of 6 individuals, all of whom I hope have some version of lived experience with either addiction or mental illness or some chronic illness, so that we can borrow, again, from what we know with prevention and the role of peers in connecting people to the services that we have available in this community.
We have just a couple of minutes left here with Dr. Mendoza, and, I've seen interviews with you on television. You seem like a pretty upbeat guy, a pretty optimistic guy, but I wonder, is where we are right now in terms of not just the opioid epidemic, but also COVID in particular, because that's, as we say, getting a lot of the headlines. Is it frustrating? Are you frustrated right now, or is it hard to maintain that upbeat feeling that you're trying to give?
Look, if you were to rewind time to 7 months ago and ask ourselves, could this community come together and do everything that we ask of it? The reality is, I think most people would have said, gosh, that's a big ask. But now we look back 7 months later, and we are nowhere out of the woods on this by any stretch. But if you look back on how we have come together as a community, I think it's nothing short of inspirational to see that people have come together, have accepted what by every measure is a very unusual time that has caused, untold numbers of economic and mental health and social consequences, that we've come together and that we've come this far, I think is a reason for optimism. It doesn't mean that the work is over. It doesn't mean that we're not learning more. It doesn't mean that we're going to give up. But I think if we can focus on what has worked to get us to where we are, I think that's certainly motivational enough for me to want to keep going. But there isn't an individual in this community who hasn't sacrificed in some fashion throughout COVID-19. But I think it's that resilience that we have together that will get us through this crisis and any other.
It's like you said, we're not done yet, but I'll tell you what, buddy, you just made me feel a little bit better. Just a little bit better.
All right.
Not
Very
bad.
good.
Not bad. We're making progress, right? One at a time.
There you go.
Dr. Michael Mendoza, Monroe County Public Health Director. Hey, thanks so much for your time. I know you're very busy. Your schedule right now is jam-packed. We really appreciate you taking some time to talk with us here today. Thanks so much.
Thank you, sir, and thank you for all you do to spread the good word. Keep it up.
Thank you. We're going to take a break, come back, wrap it up here with the Villa of Hope radio show on the WYSL stations.
You're listening to Villa of Hope Radio on the WYSL stations.
Villa of Hope is here for you. Adults, youth, parents, grandparents, no matter who you are, we are here to respond to you and make connections to the services you need right now. How that help looks may be different from before, but we are committed to making sure we are giving you our best while keeping everyone as safe as possible. Let us help rebuild your resilience. Call 1-877-584-HOPE. That's 1-833-993-HOPE.
The one media outlet you can count on. The voice of liberty. The WYSL stations.
I'd like to thank all of our guests for our Villa of Hope radio show this time around. Dr. Michael Mendoza, Monroe County Public Health Director, Monroe County Sheriff Todd Baxter, and of course Gerianne Puskas as well, Chief Advancement Officer at Villa of Hope. Now join Villa of Hope for an hour of gratitude and hope next time around. Hear from people that had the strength to ask for help and change their lives. Our next fresh show will be coming up on Thanksgiving, Thursday, November 26th at 6:30. The Villa of Hope radio show right here on the WYSL stations.
Thanks for listening to Villa of Hope Radio on the WYSL stations. Find out more at villaofhope.org.